Well, anybody can get so excited that they, lose control of themselves. But with urine, OMG, your dog steps in it, you step in it, and then your dog's tail gets in it, and then it spatters. Don't lose patience. We can manage this. If you've had a dog who's had this problem, tell me about it. Type it into the comment line. And in fact, tell me where or when, what kinds of situations triggered the behavior. Because whenever we're diagnosing a behavior disorder, the history is so essential to the whole thing, and the circumstances that preceded the behavior are important. We have to absolutely understand that. So, by the way, in case we haven't met, I'm veterinarian Dr. Jeff Nickel. This is Miss America, the Nickel family border collie. Miss America, can you sit up so people can see how cute you are? And this is Gaston here, and this is Tony, the Nickel family cats. And today we're talking about dogs who lose control of their urine. And it is intensely frustrating for people because the problem tends to happen in the same situations. Like I was just saying, we've got a problem and it keeps repeating, and people, they scold the dog, they reprimand the dog. Sometimes people have lost their patience to the extent that they have punished their dog. And when this has got an anxiety component or fear involved in it, those things get worse. Thank you, Carolyn. And so, Martha, wonderful. Thank you for coming. I'm delighted you're here, and I hope this turns out to be helpful to you.
There's a second person.
Oh, and there's somebody else here. Share this video with friends. All right. Well, hold on here. I can't do that. Martha is here, and whoops. Well, I don't see nobody else has shown up yet. Oh, all right.
So what you do is just tap that corner.
Oh, but I still only have one person. All right. Anyway, I like to say hello to everybody who comes. And, okay, that's all I can find so far. Anyway, thank you, Martha, for coming here. By the way, we're starting 30 minutes later than usual. Normally, of course, we do this stuff at 6 o'clock. But there was a webinar tonight. Oh, Monica. Hey, hello. Thank you for coming. Carolyn, Monica has a Hello Kitty little icon there. Carolyn has an excellent thing for Hello Kitty. Just does something for her. That's right. And anyway, so tonight at 5 o'clock until 6 was a webinar put on by the American College of Veterinary Behaviorists. That's, of course, the specialty college where I did my residency training. And they, this time it was on, we have a lot of urine issues with cats and dogs. And this particular one was on cats. And that because of that and because of urinary tract disease, there are lots of lectures that you can attend on that, and we all need to be knowledgeable in it because all veterinarians see a lot of this kind of stuff. And you'd be impressed the number of them where the specialist who's giving the seminar doesn't know that other people have named theirs the same thing. And of course, this one was titled To Pee or Not to Pee. Not especially imaginative. I'm not going to dump on my colleague who gave this because she did a marvelous job and brought to light some research, old and new, all of it very relevant. And so I was delighted to participate, but then I had to get...
Cynthia and Cindy are here.
Oh, Cynthia and Cindy Coleman, wonderful. Thanks, you guys, for coming. This business of dogs who lose control of their urine is a pretty common problem. And the issue, well, let me tell you a story. This is a story of a dog named Charlie, a little girl dog. He was about 45, 50 pounds. Very sweet dog. And she belonged to a really nice couple in Santa Fe. And her dad worked full-time, and every night when he came home, he walked in the door and said hello to this beautiful dog of his and patted her on the head and gave her a little hug, and every single time that dog leaked urine on the floor. Now, these are nice people, but they were flummoxed because, they'd gone to the internet, they tried this and that. Oh, you knocked over, St. Francis here, Tony. Hold on there. Let me get St. Francis back here. We don't want to abuse him. Anyway, so, what are we going to do with this? Well, took a thorough history on this girl, and it turns out that are body signaling. And in fact, I always ask people to send me videos of their pets before they come in for a consultation, because this is what's going on at home. And the presence of a stranger like me isn't a factor. So what was happening was that as soon as Charlie heard her dad roll up in his car, she would start to get that combination of body signals showing how excited she was, but also that she was actually getting a little bit anxious. And so when he would walk in the door and make this grand entry, and he's a big man with a booming voice, real nice fellow, but he would approach and lean over her. He's a tall fellow, and he would lean over her, and she would just kind of shrink and dribble urine. Well, there's excitement urination, and this is clearly a case of that. There's also submissive urination, and I'm going to talk about that in a few minutes. And I look back on Charlie's case, and there were elements of each of these. When we make a behavioral diagnosis, oftentimes there's other factors, behavioral factors, not to mention the possibility of other physical factors. But she was a good, healthy dog, checked out fine on physical exam, had a normal urinalysis. So we were dealing with a behavioral issue. So, what do you do about this thing? Well, the first thing I explained to these folks was, number one, when Charlie's dad came home, his job was to do something he didn't want to do, which was to ignore this dog he loves. Nobody wants to do that. You've been at work all day, it's been kind of tiring, you come home, you want to relax, and you want to greet, in his case, his wife and his dog. And I told him, forget that you have a dog. Completely ignore Charlie. And so, really? Oh yeah, because the context is what this was all about. The only time Charlie, got low and wigged out and dribbled urine was when her dad came home. It was the only time. So let's disassemble the context. Take Dad and Charlie out of it. So he comes home and acts as though there is no dog, says hello to his wife, and goes about their business. Now, Charlie, in her history, had other indicators of anxiety as well. And so I wanted this dog to be set up to succeed as quickly as we could, because if we don't, these problems get worse. So we started her on a very safe anti-anxiety medication called imipramine. That's imipramine. Now, imipramine, that's the generic name of it, is used in children who wet their beds. It isn't necessary for anybody to have an anxiety problem, but we use this medication in part because it has a side effect that works very nicely for us, and that is urine retention. Now, of course, you dose it too high, you can retain too much urine. That leads to other trouble. But with moderate dosing, we can retain some urine, and that'll help set the dog up for success in this case. So we started that, and the problem improved. But even though, and of course, I wasn't there when he would come home, take their word for it, he did a good job of ignoring, and she still anticipated him and still got kind of nervous, and less often, but still too often, would just get kind of sheepish and dribble urine. And this is involuntary. And that's the problem with trying to punish this sort of behavior, like the dog is doing it intentionally. They are not. Dogs have an innate instinct not to soil their living quarters. Now, when they're puppies, they don't understand that, and they need to be house trained. But the reason we don't typically need to re-house train adult dogs through their lives, it's not like you have to rehearse the behavior so that they don't forget. It becomes part of their innate behavioral repertoire. We just don't do this as adults. But it was still happening somewhat. So we took the next step in terms of management changes, and I explained to the wife in this case, who was at home at that time of day, that if her husband were to call her or text her on the phone when he left work, so that she would know pretty closely what time to expect him to walk in the door, then she would put Charlie in another room prior to his arrival. So, she could still hear him through the, dogs, young dog, especially like Charlie, he had pretty darn good hearing, especially with those ears, right? She wasn't going to miss anything. And so we had her in the other room. So she hears less volume of her dad coming in the door, but she didn't see him. And that allowed her to stay calmer. And he could come in and he could greet his wife and sit down and relax. And as soon as he was seated and settled, then his wife would open the door and allow Charlie to come out. And when she came out of the other room to greet her dad, he was, by her perception, he appeared smaller because he was sitting. And when people are sitting, of course, they're less mobile. And so he's just a lot less of an overwhelming figure for her. And then she could approach him when she felt relaxed, and he would quickly check her body signaling. And when her body posture was soft and relaxed, that is when he would respond to her and greet her. And here's another important facet of that, is that when he didn't pay any attention until she showed the correct emotional state, that is being calm, that earned a reinforcer. You have to remember that dogs don't believe that they have any right to an interaction with their people. And that's a hard thing for us people to get our brains wrapped around, because those in our family, our close friends, if you're in a hierarchy like at the workplace, there's still an expectation that you can ask questions, start a conversation, and have every right to expect a response. But that's not the case with dogs. They're really big in the hierarchy, and Charlie knew her dad was higher status. And so she had no right to an interaction, because that's the way dogs think. We can't change the way they're programmed. So we work with it as good canine leaders. And so when he learned that she would come out and he checked brief glance while he was ignoring, and if she showed a little calmer emotional state, he would very quietly say, "Good girl, Charlie." And with repetition, she learned that this is the new default behavior. This is what we do now. Dad comes home, I wait patiently, I come out, and they found that with time and practice, that she would show that calmer body posture sooner, because she wanted to earn the reinforcer of a response. But his response needed to be quiet. "Good girl, Charlie," like that. This isn't to say that this man shouldn't enjoy his dog and play and throw the ball and wrestle and roughhouse and all the other things they enjoy doing together. Totally. Don't stop doing that great stuff with your dog, but you just don't associate the excitement with, in this case, the context of when the problem occurred, with him arriving home. So this thing ended up going very, very well. Part of the problem here is men. There are people who come to my exam room and they've got a dog who's very frightened of men. Often it's a married couple, and the dog is very bonded to the woman, but the man scares the daylights out of the dog. And these are people who have been very kind to the dog. So what is the problem? Well, people often say, well, the previous owner must have mistreated this dog, and it was a man, because the dog seems to fear all men. Well, I'm not going to suggest that there isn't such thing as animal abuse, because we know that happens. And by the way, we know that both men and women, including children, can become angry and lose their patience and treat pets badly. More often, the issue is that we men are typically bigger than women. We have these booming voices. We have these short, choppy movements. And we tend to, without meaning to, just by virtue of our normal actions, you compare that with a woman, and these, of course, have been scientifically studied. But women typically have more graceful movements, more evenly modulated voices. They're a little smaller. They have that archetypal feminine nurturing thing that's hard to put your finger on, but most women have that. And if you're a scared dog, one of these looks a lot better than the other. So the takeaway for men who have dogs who do this stuff is, in a broad sense, wait for the dog to come to you. You can sit on the floor. You can lure the dog with a little food. But don't get into these high, squeaky, active voices, thinking that if you show this real happy, jolly routine, that the dog's going to say, "Oh, what fun you are, I'm going to come." That's not it. Another important thing for these dogs is that they not feel overwhelmed because you're approaching. Many dogs, we love dogs, don't we? And we love cats, although my cats are on the floor now. They're waiting for more snacks, Carolyn. I don't know if you have anything that Tony got a little carried away here with my picture of Juan and my statue of St. Francis. He was all over the place here. Carolyn's going to reload our indoor hunting feeders. Oh, well, that doesn't necessarily go well, but
Sprinkle it out.
oh, all right, that's a good idea. Thank you. All right, Tony. Come on over here, Betty. Here. There's some for you. There's some for Gaston. There we go. See? We have cats. Cats who, they're up here for the food. They came here for the free lunch. Okay. Oh, Beth Miller, you're here. Wonderful. It's great to hear from you. You haven't been here for a little while. I hope things are going well in Dallas. And you've gotten your vaccines, of course. Beth is a nurse, so I expect you got vaccinated before the rest of us, which you legitimately should, because you can be high risk if dealing with people with medical issues. So thank you for doing your work and for being here. So anyway, these dogs, what you do with them if they look nervous is you never approach, you don't reach for them, and you don't lean over them, and you don't stare at them, because these can be perceived as threats. Now, there's threats that are real severe, and there are threats that are sort of subtle, and we don't mean those things. But what we don't want to do is inadvertently frighten a dog, and especially one like Charlie, who already has that tendency. And so what her dad was doing, by the way, after he was seated and settled, and his wife let Charlie out of the other room, was he was giving her a choice. She could approach him when she felt ready. And of course she did right away because she loved him. But that involuntary stab of fear was not by her choice. So if people mistakenly reprimand or scold their dogs, they make it worse. And if you've done that, please don't feel bad. Losing patience, even anger, those things happen. And, as I like to close these Facebook Lives by saying that at any point in a relationship, our pets can learn that we had no intention of intimidating them. You can change course at any point. They're remarkable at forgiveness. There's so much that we can take away from the lessons we can learn from our dogs. I had and Beth will remember this guy because I've shown his picture before. Beth was one of my staff. I'm sure she doesn't want me to say how long ago, but anyway, quite a while. And I had this wonderful dog, Juan Gomez, this Airedale, and he was this man's best friend. And he was a obedience competition dog who he was nationally ranked one year. That's how good he was. Anyway, I made mistakes with my training with him. I did lose my patience a time or two, not often. And he forgave me. And we went on to do great. And so, they are our best friends because, well, for a lot of reasons, but one of them is that they can teach excellent lessons. So with those takeaways that I got from him, his patience with me actually set me up to be a father. And that's when I began to realize that I actually had it in me to raise a family. And I found my excellent wife, and our children, well, they're in their late 20s now. They've finished college and they're living their lives, and, life is good for them. So we can grow, and our pets can be a really valuable part of that. So, there are other causes for this kind of urination. Some of it's excitement, some of it is fear-related. And an important other little bit of wisdom on handling these pets is that if your dog has a tendency to get excited or submissive and fearful in a particular location, is that when you say get home or whatever it is that might be triggering this response, is that you can go directly to the place where you want your dog to urinate. So for example, if Charlie's dad were just a single pet parent, he didn't have anyone else living with him, he wasn't married or whatever, then when he came home, what he could do would be to go directly to the yard, open the door and allow Charlie out and go to the place in the yard where he wanted her to urinate. And then if she did there, he could tell her she's good and take her for that immediate reinforcer, which is a walk off property, so that she would know that, oh, urinating, this is where I do it, and I don't have to worry about losing control and doing it inside our living area, which is another really important point, and that is that dogs have an innate belief not to soil the living area. And so when they lose control, and it's involuntary, they feel real bad. And some people misinterpret that, and they say, well, I know that this dog realized that he made a mistake, and it can be male or female dogs, by the way, who can be victims of this problem, and they immediately know that they've made a mistake, and they immediately feel bad. And part of that is because they may have been reprimanded previously, but gee, I just soiled the living area. Oh my God. And how embarrassing is this? I can't control my bladder. And some people, they've made the mistake of making a joke or laughing at the dog or ridiculing. They understand that those are not the kinds of positive emotions that they want to earn from us. Because don't forget that they don't feel entitled to any response from us. So every response we give them is, they believe, earned. So what are we trying to reward, and how can we bring out the best? Well, we really ignore bad behavior or inappropriate behavior or involuntary behavior that's made a mess. We don't respond. We set the dog up to succeed instead, and then when they do, and in Charlie's case, her success was that she calmed down and she relaxed. And her dad said, "Good dog." And there's a tendency, for us to say, "Hey, this is improvement. I'm really excited." And so I'm going to say, "You're wonderful. You've done such a big job of being such a good girl," right? And then your excitement in that context can trigger the dog to get overwhelmed again. Okay? So excitement is great, but choose the context. Be very cognizant of what can bring out the behavior you want in that context, which is, we wanted Charlie to be calmer because then she was not going to lose control. Thank you for those hearts, by the way. She was not going to lose control if everybody was cool. So her dad had to go wait until she earned the response by choosing to show a calm emotional state. And dogs can choose to show the body signals they want to. It's very much voluntary. They communicate with each other and their people almost all the time, even if we don't realize it. And she learned that when I show a softer body posture, my dad's going to reinforce me, and I earned that. And when there's a paycheck, I'm going back to that job. And when there's nothing that comes, like I don't get a response when I wig out and get crazy and excited, that doesn't earn anything, well, what's the point in that? And furthermore, it's a lot easier to stay calm because, he doesn't appear through the door like magic, and then I've got to deal with my emotional state. So Charlie was set up to succeed, and she's done beautifully. And over time, we were able to taper off the medication, the imipramine, I-M-I-P-R-A-M-I-N-E. That's available generic. It's a prescription, but veterinarians, you don't have to be a behavior specialist to prescribe it, and we don't even need it anymore. There were no side effects. She did great with it. We could use it lifelong. We didn't need to. Now, there can be other things that can cause a dog to urinate indoors, and all right, there we go. I just got a, Isabella. Hey, thank you. From Austria this time. Isabella, you are a world traveler, my friend. And you are welcome. She's thanking me for all that I do. And it's a labor of love, you can probably tell. I was 8 years old when I decided to become a veterinarian. It's all I've ever wanted to do. And I'm still at it. A lot of my contemporaries are retiring. I don't know why I would do that. Anyway, so other things that can cause the problem that might look similar. For example, some dogs actually have incontinence. People mistakenly call this urine loss of control, like excitement and submissive. They can think that is incontinence. It is not, actually. Incontinence happens when a dog just dribbles urine, or a cat or a person dribbles urine, and there was no trigger. There was no fear. There was no excitement. It just happens. And by far the most common cause occurs in female dogs who are spayed. In fact, about 20% of female dogs who've been spayed, the estrogen level in their system, because we've removed their ovaries and their uterus, is just low enough, and estrogen helps to maintain tone in that circular muscle at the neck of the bladder called the sphincter. And in 20% of spayed dogs, their estrogen drops just a little too low, and that sphincter stays closed when they're fully conscious. They're not dribbling urine as they run around, and it's got nothing to do with excitement or submissive urination. But when they just relax so much that they're asleep or resting and dozing, that level of deep relaxation, then that sphincter at the neck of the bladder gaps open a little bit and they'll drain some urine. And people have made the mistake of punishing dogs for that. Don't do that. Now, dogs with what's called USMI, urinary urethral sphincter muscle incompetence. Unlike many dogs who are affected, she developed the problem when she was about 10 years old. The great majority of those female dogs who are going to have this problem, they start dribbling urine in their sleep, usually several months or after they've been spayed. You do have to keep treating it for a lifetime if you use medication. There is another medication called Incurin, I-N-C-U-R-I-N, which is a synthetic estrogen, which is very safe. Typically can be given once a week, and they typically do very, very well with it. And there are now a very good surgical method that can be done so they don't have to take medication. And it amounts to a little balloon that's installed around the neck of the bladder. And it's adjustable if you want to get into that. Usually that's reserved for the pets who just don't respond to medication, and nearly all do. So, common problem, and people shouldn't feel like anybody has to live with it. And those dogs are embarrassed by it. They wake up in the morning and go, my goodness, what the heck have I done? It's not their fault. You know, there are a lot of great reasons, very important reasons for spaying and neutering. But the truth is that the physiologic system was built for a functioning reproductive tract. And so by fooling Mother Nature, by removing the reproductive tract from a female or the testicles from a male, we get benefits, but there's a flip side to that coin. And so we have a responsibility to manage that, and everybody feels better. So Miss America takes Proin once a day, P-R-O-I-N. It's a prescription medication. Incurin is as well. But your veterinarian almost certainly has that on the pharmacy shelf, and if not, the doctor can order them. They're very commonly used. Another thing that many people get confused by is older dogs, although you don't have to be old to have arthritic problems, but they're common in older pets, and older cats too. Their joints just get stiff, and we call it degenerative joint disease, DJD. But these are arthritic changes that, you know, what do you do about that, right? Well, number one, try to keep your pet's weight normal, keep them athletic and trim, and there's less load on the joints and less inflammation in the body. But you know, if you get old enough, your joints aren't happy, and some of these dogs have a hard time getting up, particularly bigger dogs, and getting out the door, even if you have a dog door. And some of them try very hard to hold their urine, and they can't do it. Especially dogs who are drinking and urinating big volumes of urine. Dogs with diabetes, dogs with kidney disease. There are some other adrenal problems, for example, some other issues in the body that can cause the dog to produce way too much urine volume, and they can't hold it. So the first thing we do with every case where we've got dogs urinating indoors is we do a thorough physical evaluation, including a blood and urine profile, and sometimes x-rays of the abdomen too, to understand what's going on. So Amanda Bremer, Tony T, you're in the way. I can't read the... Here, come on over here, little guy. Attaboy. My dog got into an altercation at doggy daycare. It was very traumatic. She wet herself later that evening. Yeah. You know, that is so hard. They get very frightened. And doggy daycare, I often recommend those things, because it's a great opportunity for dogs to get off their territory, to sniff and investigate, and to interact socially with other dogs. These are really essential behaviors for nearly all dogs, but they don't all do well there. And most well-run doggy daycares are watching pretty carefully. But yeah, those things can happen. Dog parks can work very well too, but you know, when people bring a ball or a frisbee or treats and there's too many other dogs there, that sets them up for failure. So I might suggest that you don't go back to doggy daycare. Sorry about that, Amanda. That's really difficult. Isabella, in my experience, sometimes even the most experienced, kind-hearted pet owners understand what you are saying, or on an intellectual level. However, when it comes to corrections and rewarding, it often comes down to timing. Is this something you have noticed as well? Over your many years of experience? Yes, many years. Yeah, you're totally correct. punishment and reinforcement are essential parts of learning theory. And one thing that both of those have in common is the value of immediacy. That means that as soon as you see the behavior you want, you say, good dog, good cat, good spouse, good child, good friend, good coworker. People love to be acknowledged, and so does everybody else. But immediacy really, really matters. When I was a kid, my mom said, when you write thank you notes, write them right away. And my wife taught our children that too. Send it out right away. Of course, it takes a couple of days for the mail to arrive, and an email, it's not that fast. But when you're training a pet or teaching them what you want, be immediate about it. Now, punishment is, by the way, not a four-letter word in learning theory. There is positive punishment and there's negative punishment, and they're probably the opposite of what you think they are. Positive punishment is positive because something has been added in. That's why it's positive. So if you add in an aversive, like a strong reprimand, or some people use electric shock collars, or they hit, please don't ever do that stuff, unnecessary. But that's positive because you've added something in. Negative punishment is what we use often, and that's because you take something away. So, many times you get a dog, for example, who gets excited or submissive, and they cower down and they let go because it's involuntary, but we ignore at those times. We ignore when we walk in the door. That's actually negative punishment, because what we've done is taken away the relationship. Now, that sounds horrible, doesn't it? But you do this consistently the same way, and the dog knows exactly what to expect, in part because this is the way a canine leader in a free-living social group does it. We're treating dogs the way they need to be treated. And so their leaders very often say, that wasn't the right behavior, and they withhold the interaction. And the dog knows that as soon as it shows the right behavior, the leader will reinforce them with access to a resource. In the case of Charlie, for example, access to her dad. So that became a positive reinforcer because he added in, it was positive, he added in his interaction as a reinforcer for her calming down. But when she was doing the wrong thing by showing fear, he used negative punishment by taking away his interaction. And she thought, all right, all I've got, I'm an operant learner, that means trial and error. I will choose a different behavior and then earn the resource. And he was consistent, and so he treated his dog like a dog. You know the golden rule, right? Treat others as you would like them to treat you. Well, I went to some motivational lecture once a long time ago. I can't remember who the speaker was. I think it might have been Zig Ziglar. Anyway, it was, don't treat others the way you want to be treated. Treat others the way they want to be treated. And that means we have to listen, doesn't it? We have to pay attention. And that's empathy, right? Say, that other person is not identical to me. Their needs might be different. And members of other species, like cats and dogs, their needs are really quite different. Because, as I said at the beginning, it's one thing to get excited. And you might even lose control of yourself, but your bladder? Well, it can happen with children, right? They laugh so darn hard they wet themselves, right? Well, most everybody outgrows that. And in fact, with puppies, they'll often, when their mother approaches, they'll often roll over on their back, raise one back leg, and dribble some urine, and that is a healthy, normal canine signal to the mother. And the mother reinforces that because it's part of the hierarchy. But as they mature, not only behaviorally, but their peripheral nervous system to their bladder matures. That stops happening in most cases. But we still get some like Charlie. So her dad did the right thing. He followed good modern behavior science, and we got a very good result. So, there are other things too that can cause dogs to urinate. Dogs with cognitive dysfunction, which is the veterinary term for dementia, very similar to Alzheimer's. Some of those dogs will forget their house training skills. That's a treatable problem, but we need to get it early. And then some dogs have urinary disease. So again, if your dog is doing this stuff, the first stop is to have your veterinarian do a good exam, submit a lab profile and a urinalysis, and look for all possible causes of everything going on that's outside this organ up here. And when we've ruled out everything else, then we look at behavior. That makes sense? And so I just want to encourage people to take the time to build a foundation of trust and choice and freedom for your pets, because dogs and cats, just like people, can become obstinate if their leader only wants their needs met. It has to be a two-way street. You know, we think of them as our subordinates, and they legitimately are. You know, you look at Miss America here, and she's got her eye on me a lot of the time. Oh, she loves me. I mean, we're strongly bonded, this little girl and I. But she's waiting and hoping for behavioral cues. And you've noticed I'm petting her, which I sort of do unconsciously. But it reinforces her for being calm. She's learned this over the years. And so what I'm doing is operant conditioning, because she could choose a different behavior, but this one earns the resource, and she is not entitled to it in her little canine brain. Actually, she has a very big canine brain. She's a pretty smart dog. So thank you for spending this time with me. Just remember that they can learn any time during a relationship, that they can trust us not to intimidate them. And if you've made that mistake, join the club. I'll forgive you, and I'm sure that your dog and your cat will, especially if you say, okay, what can I do differently? And you can, by the way, if you need help with a behavior problem, you're very welcome to contact my office. My website is drjeffnicol.com, drjeffnicol.com, no S on my name. And you get my website. By the way, at the bottom of the website, you can subscribe. And you just put in your email address. It doesn't cost anything. And every week in your email box on Tuesday mornings, you get my Facebook Live video and my weekly blog. That's my column, my newspaper column from the Albuquerque Journal from the week before. And I'll also send you, for joining, my free at-home pet first aid and CPR guide. But if you need help, on my website, and we're actually making a change, and those changes should be in place in the next several days or weeks, shouldn't they, Carolyn?
I think so.
Yeah. We've got a webmaster who does just a wonderful job for us. And you'll be able to go there and either sign up just by yourself. You don't even have to call, and participate in a Zoom group conference. We do these weekly, many for dogs, some for cats. And they are a group of 4 pet parents. It can be 4 families, doesn't matter how many people are there. And you can bring your problems, and we'll talk about them. And I'll give you some one-on-one. Now, I can't get in depth because I have 4 people to talk to, and I can't examine a pet. So if I need to prescribe, which we do need to sometimes, I would need to examine. But with more serious problems, you'll need a one-on-one, thorough behavior consultation, and those are 2 hours long, and they include a physical exam. But you can pick one or the other, and you can go to my website and do that. But don't just search around the internet for stuff. There's certainly some good information out there, but there's some well-intentioned stuff that isn't correct. So be careful where you get your advice. So thank you again for spending a little bit of your evening with me, and thank you for being here a little later. In 2 weeks, there's another webinar with the American College of Veterinary Behaviorists that I will be attending, and that is going to occur at exactly the time of my Facebook Live, which is 6 o'clock. So I'm thinking of doing the Facebook Live a little later, maybe about 7:30. We'll see if that works out. So thank you again for coming, and I hope everybody stays healthy and wears your mask, even if you're vaccinated. This is not a happy disease, so let's be real careful. Miss America says good night.